some they do say that ignorance is bliss, but for us, we say that knowledge is everything. So once again, my name is Mr. Chitumba, specialist ultrasonographer. In this video, I am going to explain the relevancy or the role of the first trimester ultrasound scan. With my experience, I've seen a lot of women asking me, why is it that our doctors are sending us for a first trimester ultrasound scan, yet the fetus is too small, we can't make much out of it? So I need you to listen carefully to what I'm going to say. I have got an answer for you today. So there are various reasons why a first trimester ultrasound scan is very necessary up to about 14 weeks. The first thing why a first trimester ultrasound scan is important or is pertinent is we need to verify that you are pregnant. So without an ultrasound scan, it might be difficult for you to appreciate or to understand that you are pregnant. Because when a urine test is done and they discover that you are pregnant or the pregnancy test is positive, it might be a false positive result, and then actually you are not pregnant. Or it can be caused by other tumors which will be producing hormones which mimics your pregnancy. So with ultrasound scan, we actually see the gestational sac developing, we can actually see the fetus developing inside. So a first trimester ultrasound scan is done to confirm pregnancy. When pregnancy is confirmed, it can give satisfaction to couples. Remember, some couples, they spend years trying to make a baby and then they'll be failing. So it brings joy, it brings success. But to some, they say ignorance is bliss, because if they don't know, it doesn't affect them. Imagine somebody's just been raped and then it's confirmed that they are pregnant. It's something that can actually cause a lot of anxiety, a lot of depression. So in another way, it might be something that can be traumatizing to somebody to confirm that you are pregnant, but it has to be known, because you cannot live with a human being developing inside you without knowing it. So whatever happens, whatever the circumstance, whether the pregnancy was planned for, whether the pregnancy was not planned for, it has to be known that it is there, so that the necessary images can be taken if need be. So that's the fundamental or the basic reason why you are supposed to do your first ultrasound scan, is to confirm that indeed you are pregnant or you are not pregnant. The second thing is we need to localize the position of the pregnancy itself. You might be pregnant, yes, but the pregnant can be at an ectopic site. It's developing outside your uterus. So ectopic pregnancy can be life-threatening because they can rupture and you can bleed to death. So when we confirm that indeed it's an ectopic pregnancy, that's an emergency, that's a surgical emergency. The pregnancy has to be removed, or methotrexate has to be applied so that the pregnancy dies outside the uterus, just like that. So ectopic pregnancies can occur in the cervix, they can occur in the fallopian tubes, they can occur in the ovaries, they can even occur in the abdomen itself. So the first trimester ultrasound scan is very important, so that we localize the pregnancy. Is it in the correct position inside your uterus or your womb, at the top part of the womb, which you call the fundus? If again the pregnancy or the gestational sac is low, it can also miscarry at any point. So we need to localize and confirm that you are pregnant in the first trimester, and also to make sure that the pregnancy is at the correct position. Having done that, we also need to verify indeed if the pregnancy that is developing is actually progressing well. Like if we do our scan, let's say from 7 weeks, 8 weeks, using what we call the transabdominal ultrasound technique, we must be in a position to see a fetal pole developing inside, to make sure that indeed you are pregnant and there is a sign of life there, and also to assess the viability of the fetus. Is it alive or is it not alive? So the fetal pole, we see the heart starting to develop. The heart will be developing there from about 5 weeks. Using a trans vaginal ultrasound scan, you can visualize the heart of the fetus that is developing. So after confirmation of the pregnancy, and we are very sure that there's a symptom of life, it means we are in the good or in the correct direction. The other thing that happens is when you get pregnant, there are things that can happen. The pregnancy itself might fail. So what happens when the pregnancy fails is only the fluid that we call the amniotic fluid can develop inside the gestational sac, and then the fetus will fail to develop. So if we are going to see on ultrasound scan that the gestational sac is there, the fluid is there, and the sac is measuring above 2.5 centimeters, we must think that the pregnancy has failed, or we take it as the pregnancy failed. We call that a blighted or an embryonic pregnancy. The embryo or the fetus is failed to develop. So that type of a pregnancy can eventually shed off. The other thing that can also happen with the failed pregnancy, the pregnancy might develop, then the placenta develops, but the fetus fails to develop. Or the placenta can develop and the fetus can develop with abnormalities. So when the placenta develops and the fetus fails to develop, we call that a molar pregnancy or a high for more. But now when the placenta develops and the fetus is developing with abnormalities, we call that a partial molar pregnancy. So those are some of the things as well we can capture, we can see on ultrasound scan in the first trimester. The other thing is we need to make sure that inside the uterus or your womb there are no other masses which can compete for space with the fetus or the baby. So essentially, if you've got masses like fibroids that can grow so big, they can occupy much of the cavity or the endometrial cavity space where the baby is supposed to grow, and they will push the baby out. Then a miscarriage can take place. The other thing that we also have to assess is the pregnancy itself, another type of an ectopic pregnancy. When we had a previous cesarean section, the pregnancy can develop on the scar line inside the myometrium, then develops there. So the risk is as it grows, the uterus can rupture, then the fetus can be expelled outside. So we are methodically looking for all those abnormalities that can have an adverse effect on your pregnancy. The other thing that we are looking at in the first trimester is we want to see or to make sure that you are carrying how many number of fetuses. Is it one or is it a multiple pregnancy? So a multiple pregnancy is got a way it has to be managed, because there are complications which are associated with the twin pregnancy. One twin might die, the other remains, or one might be getting more nutritional feeding than the other, then the other one grows smaller unlike the other, then there will be discordant of growth. At the same time, the fetus can maybe one is when it dies, the other one also dies. So all those things you will be looking or assessing the growth rates of the fetuses. Are they proportional? Is the fluid in each the same? We also check on the fetuses, they are multiple, whether they are identical or not. So if there is a single sac with one placenta, we call that a monochorionic monoamniotic pregnancy. Monochorionic monoamniotic, meaning to say that is got one placenta and the fetus are identical. When they are not identical, it means they can have two different sacs, each one developing its own sac with a septum that is thick dividing the two. We call that a diamniotic chorionic pregnancy. So such type of a pregnancy has got also a risk because it is a twin pregnancy, but the risk of a diamniotic chorionic pregnancy is lesser than the risk of a monochorionic monoamniotic twin, because monochorionic twins can be fused together, they conjoin, which you call the conjoined twins. So we are looking at the nitty-gritties of is it a multiple pregnancy? How many placentas are we having? How many sacs are we having? So that we really give the map or the picture to the gynecologists that they're dealing with twin pregnancies of identical twins or twins which are not identical. So that information is very critical, and you can capture it in the very first trimester. The other thing, in the first trimester again, we can also try to start to see the placenta growth, where the placenta is. So at times the placenta can close the channel for the baby or on the what we call the os. It can sit on top of the cervix and then close the channel, what we call placenta previa. So we also check the localization of the placenta itself. Is it developing on top of the os? Because that one can be a problem, because as it grows, if it is a complete os, the placenta is complete at the top of the os, it means that the baby cannot be delivered by natural birth. So we have to monitor that until the baby is born, and then will be delivered by a C-section. Else, if you try to deliver a baby with a placenta that is seated at the top of the os, closing the channel to the cervix, it means that the mother can bleed to death. The other thing that we are also worried about in the first trimester is we are worried about the viability, or as I said before, that is the baby alive. So we also check the heart and the location of the heart. So some of the early abnormalities in pregnancy, we can pick them in the first trimester. We can see that the heart is outside the fetal chest or thorax. So the heart can develop outside. We call that ectopia cordis. Then you can see that this fetus is having ectopia cordis. At the same time, we can also pick some early abnormalities, like the baby doesn't have got the calvarium or the skull bone. So the brains will be exposed. Then we call that anencephaly. So we can predict or we can see these abnormalities early. They can also be development of bowels outside, what we call gastrocystis. So the bowels or the intestine, they will be out. They are not protected by the skin of the abdomen. So that is called gastrocystis. Or they can be a bulge, a membrane that is bulging on the tummy of the fetus. Then the liver and the intestines and some fluid around can be collected there, what we call an omphalocele. So in the first trimester, you can see that you can predict all these type of abnormalities early. The other thing again that we can pick up in the first trimester is the fetus might die early. In pregnancy, they can die. Then you see that there is no heartbeat, they are dead. That condition is called a missed abortion. So if a fetus dies early, we call that a missed abortion. So You can see the wealth of information that you get from the first trimester ultrasound scan. The other thing that we can also pick is from 11 to 13 plus 6 weeks, we do what is called the knockout translucent measurement, which is the fluid at the back of the fetal neck. So that fluid is above 3 millimeters. It is an indicator that the fetus has got Down syndrome, is going to develop Down syndrome. So it's associated with chromosomal abnormalities. So if we see such that the knockout thickening is above 3 millimeters, we now recommend or we can recommend that the fetus be sent to a fetal specialist or perinatologist or fetal medicine specialist, so that they can also do other confirmatory tests to look for other chromosomal abnormalities using the different karyotyping techniques. The other thing again that can be picked or detected in the first trimester is you can see an abnormal ductus venosus waveform. Ductus venosus is simply a vein that connects the umbilical vein to the inferior vena cava. So when the waveform is abnormal, what is called the A wave is absent or is reversing, that can also be a pointer of chromosomal abnormalities, or it can also give us a pointer indicator that the fetus is having congenital abnormalities of the heart. The other thing that we also check on, or that we look at, is we also check on what is called the tricuspid valves of the heart. The tricuspid valve is a valve that is found in between the right atrium and the left ventricle. So that valve that is there, you also have to check it. When it is reversing blood instead of the blood flowing from the atrium to the ventricle, and then the blood is flowing back from the ventricle back to the atrium, and then you see the velocity of the blood movement is above 60 centimeters per second. It can also be an indicator of chromosomal abnormalities. So in early stages again, from 11 weeks to about 13 plus 6 days, we also visualize the anatomy of the fetus. During that period, you can see the limbs, the limbs are there. You can actually visualize the palate, the jaws. You can actually see those features, the abdomen, the thorax, and the palms, and also you can visualize the urinary bladder. So at an early stage, you can have a rough idea of normal development of the fetus. So you can see how pertinent or how critical it is to have the first trimester sonar done. The other thing that we need this sonar so much is in terms of dating of the pregnancy itself. So the correct days that we get for the pregnancy in terms of how far you are and the delivery day we get in the first trimester from 11 to 13 plus 6 days. When the fetus is roughly measuring from the crown at the top of the head there to the rump at the buttocks there, when it's measuring from 45 millimeters to about 85 millimeters. That's the period that we get a correct date, or the best date, or the best approximate date. That's where we can get the actual date of delivery, which is more correct at that period. So why should we date a pregnancy? We should date a pregnancy, one, because you might not be sure of your actual dates. People, they can get pregnant while they are using other contraceptive methods, or while they are not aware of that they can get pregnant. So we give you the actual dates so that you can plan for the pregnancy. Even at work, you can plan, when are you going to plan for your maternity leave. At the same time, also with your husband, you can know exactly which dates you got pregnant. At the same time, if you have got multiple partners at times, it can also give you a hint of when you get pregnant and who is likely might have impregnated you. Those things can also benefit you as an individual. The other thing is in terms of there are other tests which are done to the fetus. The biochemistry tests, those are dependent on certain dates. They can say that this biochemistry has to be done at 11 weeks, it has to be done at 10 weeks, it has to be done at 16 weeks. So if we know the actual dates of the fetus, we can actually say that it's now 16 weeks, so it's time to go for that other test. But if you don't know the dates, it's very difficult for any planning to be done, especially when you're developed by C-section. It's very difficult for the gynecologist to plan when is 37 weeks. So when a pregnancy is dated, it means it can be planned for correctly and accurately, which becomes better. Even when you are going to come for the second trimester, what you call the anatomy scan or the detailed ultrasound scan, it means we know exactly when is 20 weeks and when is 23 weeks. So we actually have an idea of the date. So modern techniques again, in the first trimester, using what is called the gender tubercle, we can actually predict the fetus of the gender in the first trimester, which is something that is also good for you and your couple. At times, it becomes so difficult for certain couples that they need a boy child, and then they've not been getting it for quite some time, and then they discover that it's a boy. They can bond more to that baby. Unfortunately, on the contrary, if it's still a girl, it can also cause a lot of anxiety to the couple. So you can see the interplay of all these factors. They are coming in to justify the need for a first ultrasound scan. The other thing that can happen is you might think that you are pregnant, yet you are not. You might even skip your period, and then you think that you are pregnant, yet you are not pregnant. We call that a pseudonomous pregnancy, pseudo-pregnancy. So when you come for an ultrasound scan, it means we are reassured. You are assured that indeed I am not pregnant. So you can see the value of a first trimester ultrasound scan. Imagine how it feels like if you're a woman, maybe it's your first marriage, and then you tell your boyfriend that I'm pregnant. People, they think that you're playing tricks to them, but if you come for an ultrasound scan, then it is explained to you that there is what is called a pseudonomous pregnancy. Like you've told your body that you are pregnant, yet you are not. And then the hormones in your body, they are responding accordingly as if you are pregnant. Then you stop your period, at the same time the tummy can start to grow. So that's another area as well that justifies your first trimester ultrasound scan. There are times also during which you can have a coexistence of a normal pregnancy inside the womb, and then you are going to have an extra fetus outside the womb. We call that a heterotopic pregnancy. So a first trimester ultrasound scan can also be valuable in terms of making a diagnosis of a heterotopic pregnancy, so that they know that there's an extra ectopic baby, and then it can be removed before it complicates, or before you get any type of complications from the extra ectopic pregnancy. So at times you might also have got other lesions or other masses inside your ovaries, like a huge ovarian cyst. They can also cause pain when the pregnancy develops big. So if we know that there is a cyst, it means we can also give that information. We can share that information to the gynecologist so that they can manage the fibroids before they keep on continuing to give you pain. And then you might think that you are about to miscarry. The other thing is we also need to know the length of the cervix itself. The cervix can be too short, like below 2.5 centimeters. So when a cervix is short like that, it has got a risk that it might open and then you can miscarry. So we call that an incompetent cervix. So when a cervix is too short like that, we also have to document that and refer you back to your gynecologist or referring doctor, so that they can put a cyclage. So the best time for cyclage is just after the first trimester, from around 14 weeks. So your gynecologist can put a suture so that you don't miscarry. So you can see the wealth of information that you can get from a first trimester ultrasound scan. You also have to know that you as a mother, you might have got abnormalities that are taking place inside your uterus. So if you have got an abnormal uterus from birth, what we call the congenital abnormalities, like you might have two separate uteruses, what we call uterine diadems. So if you have the uterine diadems, then your fetus is developing one uterus. There's a risk that you might miscarry because you are carrying two uterus, and those uterus might not be fully formed as what happens with women with a single uterus. So if they are not fully formed, they are not big enough, they might also pose a risk that you can also miscarry. There are also other abnormal, like what is called uterine septated uterus. Like the uterus is one, but it is with a septum in between, and then you can have two horns, or what we call the biconate uterus, that it has got two cones. Then when such happens, the fetus develop in one horn and the other does not have a fetus. The horn, because it's a small space, it might also cause you to miscarry during that period. The other thing is, times and again, I've seen from my experience that women can also be pregnant at the same time they have got intrauterine contraceptive devices inside. So with the first ultrasound scan, we can also verify that inside the womb there are no other foreign bodies like the contraceptive devices that can also impinge on your pregnancy. So you can see the information that we can get. The other things like the fluid around the baby, you can actually tell in the first trimester if there's enough fluid or there's a limited fluid. The fetus might be there but squid, and there's no fluid around the fetus. So we also know that there's a risk that pregnancy might not go anywhere far. So if there are twins also, we can see what is called discordancy. Like maybe there's a amniotic fluid in the other that is less than the other side. So this is all information that we can actually get when you are pregnant. And also other masses that can occur outside the uterus in the peritoneal space. We can also pick them up, and also they can maybe give a false impression that the pregnancy is grown so big, yet it's due to the mass that is there in your tummy or in the stomach. So if that happens, the gynecologists know that the size of the womb or the size is not due to the pregnancy, which is too early. It is due to the mass that is there, and they can manage it accordingly. So you see, there is an interplay of a lot of factors that come into play when you do your first trimester ultrasound scan. So it's the time which is our compass. We get the guidance. The gynecologists get the guidance from the first trimester ultrasound scan, mapping forward to say that we are dealing with how many fetuses which are there. And the dates we know exactly. So when you're going to come for a subsequent scan in the second trimester for what is called a detailed ultrasound scan, we already know that we can predict the growth pattern from there, comparing the days that we got in the first trimester vis-a-vis the days that we are going to get in the second trimester, and then you can be assured that the fetus is developing well, or there is some lagging behind, or standard growth is taking place in your fetus. So again, we can predict using what is called the uterine arteries if we are going to develop preeclampsia in the second trimester from about 20 weeks. So preeclampsia is just it's just hypertension in pregnancy that takes place from 20 weeks, and it can also affect the function of your kidneys. That is what is called preeclampsia. So preeclampsia is one of the challenges that can actually lead to the death of a fetus inside the uterus, or it can complicate and give problems to the mother. Then the mother can have convulsions, and then they can die when it complicates to what is called eclampsia. So you see now, when we do the uterine artery Dopplers, we can get the wealth of information that there's a risk that preeclampsia may develop when the uterine artery Dopplers are abnormal. So you see, all that information is very critical, and you get it when you do the first trimester ultrasound scan. So if you miss the first trimester ultrasound scan, you can get surprised later in life. And then you get the surprise that the cranial vault or the calvarium of the fetus is not developed. Your fetus has got anencephaly, and by that time they might have died. So it's very pertinent that you have your first ultrasound scan done, and then you can plan accordingly. At the same time, you can bond with the fetus, and also maybe the husband will be happy that we have tried for a long time to make a baby, and now we have one. Thank you so much for listening. I hope you take this seriously, and every time you get pregnant, you are going to make an effort that you are going to have that first trimester sonar done every time. Thank you so much. Let's meet again in the next videos. Thank you once again.